all the vertebrae, and also you can see a little bit about the inguinal canal. I think we have done that once, I think, in the first year. Just you are revising that. Lumbar plexus, and also the muscles of the back muscles. So first, let me explain the vertebral column. Or you can sit around this table otherwise. Okay? It's okay? Or you can stand here.
Just sit around the table.
Sit around, you can see.
Okay, later you can come here.
Okay.
Specimen, okay? Just sit around this. 33 vertebrae are there. So total 33 vertebrae are there. All 33 vertebrae you cannot see because there are 4 vertebrae. They fuse together, they form a single structure called as coccyx. Coccygeal vertebrae, they join to form coccyx. Then sacral vertebrae, 5 are there. They join to form sacrum. That means 9 vertebrae you cannot see. They fuse to form 2 structures there. Okay? Whereas remaining vertebrae you can see. That means 7 cervical you can see. These are all 7 cervical. Then 12 thoracic vertebrae are there. Then this big vertebrae here, lumbar vertebrae. So if you get a vertebrae for the spotters, it may be from cervical region, it may be from thoracic region, it may be from lumbar region. You cannot say it's sacral vertebrae or coccygeal vertebrae because you cannot have the separate sacral vertebrae, or you cannot have a separate coccygeal vertebrae. Okay. Now among these vertebrae, cervical, thoracic, and lumbar. So how to identify the vertebrae as you get? Cervical vertebrae, they have one feature there. In all cervical vertebrae, you can see this is called as transfer process. In the transfer process of all cervical vertebrae, you can see a foramen. This foramen is there in all cervical vertebrae. This is called as foramen transversarium. Foramen transversarium. So you can see this also in all vertebrae here, all cervical vertebrae. All cervical vertebrae, they have this foramen. So till here cervical vertebrae. Next, thoracic vertebrae. So how to identify thoracic vertebrae? On the sides of the bodies of thoracic vertebrae, this is the body of thoracic vertebrae, body. On sides of the bodies of thoracic vertebrae, you can see the facet, because ribs, the posterior end of the rib, come and join the bodies of the vertebrae. Okay? So they form an impression there, facet there. So you can see this small facet there. This all you can see on the bodies of the thoracic vertebrae. This facet is called as costal facet. Costal facets present on the bodies of the thoracic vertebrae. Okay. On this side, because there are 2 ribs articulated, one from this side, one from this side. So you can see the costal facets on the sides of the bodies of thoracic vertebrae. Okay. So cervical foramen transversarium, thoracic costal facet, no foramen transversarium. So lumbar vertebrae, they don't have both these features. No costal facet on the body, no foramen in the transverse process. Those are called as lumbar vertebrae. Okay, if you take any vertebrae, what are the parts of the vertebrae? This vertebrae you take, it contains a front portion called as body. This body here. Okay. Then from the body you can see the small projection coming back here.
Now, the dorsal division of L2 and S2, they join together. Dorsal division
this part here, you can see from here to this part here, only this much area. These are called as pedicles. Pedicle. The pedicle will continue back here. This is called as lamina. This is lamina. Okay. So this is pedicle. And this foramen here. This is called vertebral foramen. So on sides of the vertebral foramen, this side and this side, it's called pedicle. Behind, this is called lamina. This is called a lamina. Okay. Now, where the pedicle and the lamina join, you find three extensions there. You can see one projection going to the lateral side, where the pedicle and lamina join. You can see one extension going laterally. This is called as transverse process. Same thing on the side also, you can see transverse process, where the pedicle and the lamina join. Again, one extension going up here. This is called a superior articular process. Superior articular process. One section going down, inferior articular process. Okay. These are present where the pedicle and lamina join. Superior and inferior articular process, transverse process. Okay, next the two lamina join behind. And where the two join there's an extension going back there. This is called as spine, also called as spinous process. So what are the parts of vertebra means? It contains body, it contains two pedicles, it contains two lamina, it contains two transverse processes, superior articular processes, two are there, inferior articular processes, two are there, spine. These are all parts of the vertebra. Okay, these are the main parts there. If you see the pedicle there, above the pedicle you can see one notch there. Below also you can see one notch, isn't it? This is called superior vertebral notch, inferior vertebral notch. Superior and inferior vertebral notch. This is notch here. You can see it's curved, isn't it? It's called inferior vertebral notch. It's a very big one. Superior is small one. If you articulate the two vertebrae there, inferior vertebral notch of this vertebrae, superior vertebral notch of this vertebrae, both together, they form one big foramen there. Foramen. This foramen is called as intervertebral foramen. This is the intervertebral foramen. So whatever structure present inside the spinal cord, means spinal nerves, come out from this foramen. So intervertebral foramen is present between the two pedicles of two different vertebrae. Okay. Okay, now that's about the different parts of vertebrae. I think cervical vertebrae we studied already, right? Isn't right? Last week. Okay. Finished thoracic vertebrae in the respiratory system. Have you finished that? Finished that, right? Thoracic vertebrae finished. Okay, we'll start today. We'll cover the lumbar vertebrae. Lumbar vertebrae. So lumbar vertebrae means don't have foramen transterior, they don't have costal fascia, and they have very thick, very big body, because the thickness of the body will increase as the vertebrae go down. Okay, in cervical region the body is very thin, thoracic a little thicker, and lumbar is very thickest. Okay, next to this lumbar vertebrae, how many are there? There are 5 in number. There are 5 lumbar vertebrae. First lumbar here, second, third, fourth, fifth lumbar vertebrae. This lumbar vertebrae, first, second, third, fourth, they look similar. You cannot make out which one is first or second or third or fourth. They all look similar. That's why they are called as typical lumbar vertebrae. Typical. Whereas last lumbar vertebra looks different. It's called as atypical lumbar vertebra. So you study now typical lumbar vertebra. That means 4 together. And one atypical lumbar vertebra. So typical lumbar vertebra means what special things it has.
Now, the latissimus dorsi, you all know it is also supplied by nerve to latissimus.
So it has a transverse process. It's very thin and it's very long. Very thin and very long. Okay. And it's at the junction between the pedicle and the lamina. That you know already, isn't it? Transverse process at the junction between the pedicle and the lamina. When the pedicle and lamina meet, transverse process happens. Transverse is very thin and it's very long.
Which part of the pelvis?
Spine is somewhat quadrangular. Spine is quadrangular. See, spine is also long there, horizontal, and somewhat quadrangular. The other thing is that if you measure this one and this one, distance between the superior articular process and distance between the inferior articular process, if you measure this, superior articular processes are placed away from the midline. Inferior articular processes are very close to the midline. Or you can say distance between superior articular processes is more when compared to distance between the inferior articular processes. That way also you can say. Inferior very close to midline, superior more. Okay? So these are the main 2-3 features. One is transverse process, very thin and long. Other thing is attached to the junction between the pedicle and the lamina. And spine, you can say it is somewhat quadrangular. It's very big and quadrangular. Another thing is distance. This distance. Okay? This distance. Superior articular process distance more. Inferior distance between inferior articular process less. Okay. Next, if you go to the fifth lumbar vertebra. The fifth one. Fifth one. This distance I was just telling, isn't it? Superior articular process, inferior articular process distance that here is almost same.
And levatus scapularis.
That means they are in one same line there. Superior articular process distance between superior articular process, distance between inferior articular process is almost same. They are in one line there. That's one. Another thing you can see, spine is, you can see it is narrow there. Spine is narrow. It's not very big and quadrangular. It's small, narrow spine.
And
you can see it's not horizontal, that it's going down, pointing down. Next one about the transverse process. You can see that transverse process is short there. Actually, this is the proper one. This is not the wrong one. This one. It's very short. Transverse process is very short. It's very thick. You can see it's very thick. And you can see where it's attached. Attached not at to junction between the pedicle and lamina, isn't it? Attached to the pedicle and also to the body also. It's very thick because it needs more space for attachment, right? Attached to the pedicle and also the lamina. Spine is very thick and short, attached to the pedicle and the lamina. Pedicle and the body. Sorry, pedicle and the body. Okay. So these are some features. So if you get this vertebrae, you would say that it contains thick and short transverse attached to the junction, attached to the body and the pedicle. Distance between superior articular process and inferior articular process same. These are the features of this vertebrae. If this vertebrae you get, you write that this distance you can say this is less, this is more. Or transverse you can say it's thin and long. Or you can say where the transverse attached there, junction between the pedicle and lamina. So all that, these are the features of the first four lumbar vertebrae.
Then
okay, next, so what else you find is lumbar vertebrae is that this superior articular process, on the back of superior articular process, all lumbar vertebrae, they have small projection there, rough area. This rough area. This is called as mammillary process. Mammillary process.
further subdivision.
This one.
Mammillary
Mammillary process. This you can see in all lumbar vertebra. Okay, this is mammillary process. Then, if you see the transverse process, on the lower side of transverse process, you find one rough area here. Rough area here. This is called accessory process. Accessory process. Accessory process. Huh? Lower part of transverse process. There you find one projection called as accessory process. Okay? Okay. That's about the lumbar vertebrae, few features of lumbar vertebrae. The next one is sacrum. Sacrum is made up of 5 sacral vertebrae. This contains 2 surfaces mainly. This surface which is facing forward, which is concave, this is called a pelvic surface. Which is surface behind that, it's called as dorsal surface. Then there is some surface on the lateral side, it's called as lateral surface. Lateral surface. Pelvic surface on the front, pelvic surface, and dorsal surface and lateral surface. Then it contains the upper end here, we call it base of the sacrum, we call it base. Lower end is called as apex of the sacrum, apex of the sacrum. Okay, the pelvic surface, you can see it contains some foramen there. These are called as pelvic sacral foramen. Four are there. 1, 2, 3, 4. These are called the ventral ramus of sacral nose. Ventral ramus of first, second, third, fourth. Sacral nose come out with this foramen.
Then you are going to see the
Ventral ramus of the first four sacral nose.
and one again.
They come out from the pelvic sacral foramen. It's a pelvic sacral foramen. Okay, behind,
So like this you are going
we
to
see behind here,
subdivision.
dorsal surface, it also presents a foramen there. These foramens, this is called as dorsal sacral
You
foramen.
are going to see
Dorsal sacral foramen. This is called the dorsal ramus of the same nose. First, second, third, fourth sacral nose. Dorsal ramus of the sacral nose. Okay, next,
Now, there is no subdivision in the
inside the sacrum, there's one
rotators.
cavity is there, like vertebral canal present here. There also you find vertebral canal is there. That vertebral canal in the sacrum, one canal inside sacrum, that's called as sacral canal. Sacral canal. So it is closed here. So one canal inside it, sacral canal. The sacral canal opens below here, into an opening. On the dorsal surface, lower part, near the apex, you can see one opening here. This opening is called as sacral hiatus. Sacral hiatus. Sacral canal opens below, and the opening called as sacral hiatus.
Then you are going to see
This sacral hiatus transmits over 3-4 structures. Three structures. One is fifth sacral lobe. I said 4 here, isn't it? 1, 2, 3, 4, isn't it? Fifth sacral lobe comes out from here. Coxial lobe, only one is there. That also comes out from here. Coxial lobe. First coxial lobe, only one is there. First coxial lobe comes out from here. Then there is a structure from the lower end of spinal cord. That's called phylum terminale. That also comes out from here. Phylum terminale. Okay, comes out from here. So this is sacral hiatus. Okay, next on the dorsum, I said there are foramina there, sacral hiatus you can see on the dorsum there. There are some elevations you can see here. This is called as median sacral crest. Median sacral crest.
Then you are going to see
Then there is one more elevation there, medial to this foramen, intermediate sacral crest, and lateral to foramen. You find one more elevation, lateral sacral crest. Median, intermediate, and lateral. 4 elevations. What is elevation there? Only one is clear there. Median sacral crest, intermediate sacral crest, and lateral sacral crest. This also you can see on the dorsum of the sacrum. Lateral will be lateral to the foramen on elevation like this. Intermediate is the medial to the foramen, and the median is in the midline there. Okay, next one. If you see the base now, this is I said base, right? Base contains mainly 2 parts there. This midline part of the base is formed by the body of the superior surface of body of first sacral vertebra. First sacral vertebra, right? Is formed by the superior surface of body of first sacral vertebra. Middle part of the base is formed by superior surface of body of first sacral vertebra. Lateral part of the base here. This is formed by this part. There's a name for this part here. This is called an ala of the sacrum. Ala. This is also ala. This is also ala. Ala of the sacrum. So this usually for the male and female sacrum, they measure this breadth usually like this. This breadth and this breadth. They measure. In case of males usually, breadth of the body of first sacral vertebra is more than the breadth of the ala. It's male. This one. If you find almost similar, if you find this breadth and this breadth is almost same, then it is female. Okay. If it's in case of male, body of the S1 vertebral breadth is more than the breadth of the ala.
You know how the top of the base is from the body of the first sacral vertebra? When does the ala? When does the ala form from?
Ala is formed by the lateral part of the vertebrae there, majorly transverse muscles of the vertebrae. They all fuse together to form the ala. Okay, next the first sacral vertebra body presents a projection on the front there. That's called sacral promontory. Sacral promontory. Sacral promontory. Okay. On the sides, this is the lateral surface. This is lateral surface. Lateral surface in the upper part presents one V-shaped area. This is articulated with the ilium of the hip bone. You see here. Okay. And this area is called as auricular surface. Auricular surface. Auricular. That is the word ear. Auricular surface. Articulated with the ilium of the hip bone, and it forms a joint called as sacroiliac joint. Sacroiliac joint is formed there. Here also.
The vertebral column is not straight. Okay? When you see from the lateral side, you are going to see the cervical part. This is the anterior and posterior.
So that's about the lumbar vertebrae. Next, we'll move on to the lumbar plexus. Lumbar plexus are present on the posterior wall, back wall.
And in the lumbar part,
Lumbar plexus are going to supply the lower limb. Like upper limb supplied by the brachial plexus. Lumbar plexus is going to supply the lower limb. Lumbar plexus is formed by the first lumbar, second lumbar, third lumbar, and fourth lumbar. 4 lumbar nerves. Upper 4 lumbar nerves. From here, the lumbar spinal nerves come out. The ventral ramus of the first, second, third, fourth, fifth. The 5 nerves are there. So first 4. The first 4 involved in the formation of lumbar plexus. They join together to form lumbar plexus. This lumbar plexus, where you find lumbar plexus, there is a muscle on the side here. As the nerves come out, this lumbar plexus formed inside this muscle. This ventral ramus of these nerves come out, isn't it, from this parameter. As they come out, there is a muscle there called the psoas major. So these nerves enter the psoas major muscle. In the psoas major muscle, they join to form lumbar plexus. So you cannot see lumbar plexus outside. And inside the muscle called as psoas major. It's in the posterior arm. So inside the psoas major muscle, you find lumbar plexus. And from this lumbar plexus, branches arise. And these branches will come out from the different sides of psoas major. There are 4 nerves come out from the lateral side of psoas major. One is called as ilio-hypogastric, ilio-inguinal, lateral cutaneous of thigh, femoral nerve. Ilio-hypogastric, ilio-inguinal, lateral cutaneous nerve of thigh, cutaneous nerve of thigh, supplies skin of thigh, lateral side. And then femoral nerve. These are the branches of lumbar plexus that come out from the side there. Lateral side of femoral nerve, top side of psoas major. So lateral side of psoas major, from there 4 nerves come. From the front of psoas major, 1 nerve comes there. That's called as genitofemoral nerve. Genitofemoral nerve. It supplies thigh region, as the name says, femoral. Genito means it supplies genital organ, which supplies the scrotum. Then it supplies then there is one more nerve come from the medial side. It also supplies the thigh, medial side of thigh, obturator nerve. Obturator nerve. So 4 nerves. There are 4 branches of lumbar plexus. Okay.
Now this angle is
Genitofemoral nerve. Genito, yeah.
Genitofemoral nerve exits which part of the
Front of psoas major.
from the back side.
From the medial side, obturator nerve.
Bending of the vertebral.
So most of the nerves come from lateral side of psoas major.
Right or left lateral
So
bending.
lumbar plexus are inside the psoas major. So lumbar plexus gives about 6 branches. 6 branches come from different sides of psoas major. 1 comes from the medial side, 1 from the anterior side, and 4 from the lateral side. Okay. Okay. Next topic we are going to study is the muscles of the back. Muscles of the back. So these muscles of the back.
Now you have to know which is primary, which is secondary. Then other parts of the and what is the chance
So muscles of the back, you find 2 types of muscles. First you find superficial muscles.
and the name
Most superficial you find, just under the skin you find. And then one more group is deep muscles. Superficial muscles, there's one type of superficial muscle. What they do is they connect the vertebral column to the bones of the upper limb. From the vertebral column, cervical vertebrae and from the thoracic vertebrae and lumbar vertebrae. They go to the bones of the upper limb. Some go to the scapula, some go to clavicle, some go to femoral bones of the upper limb. There are about 5-6 muscles are there. One muscle called as trapezius. So we are going to study that muscle. Trapezius.
That is one.
This goes to
And
the
third
from the
thing that
vertebral
body
column, goes to the parietal scapula.
secondary cartilage. Body
Trapezius.
joint between the body
Then that's what. So just you know the names now. You will not attachment of it. No. Just names you know. So next muscle from the vertebral column. Vertebral column goes to the humerus. That's a muscle called as latissimus dorsi.
Now, what
It's
is
called lats.
clearly
Latissimus
what
dorsi.
you have to understand?
Four lines. Okay, I'll show the muscles.
You know, between the
Latissimus
body
dorsi.
and the intervertebrate disc.
Latissimus dorsi.
Now, what is important is
Then one more muscle now from the neck region.
the intervertebrate
Vertebral column, vertebral region, neck region. Comes to the scapula. That's called as elevator scapula. As an
Now,
exercise, elevate the
the
scapula.
spinal nerve,
Elevator
the
scapula.
dorsal lemma of the spinal nerve.
And there are two muscles now from the vertebral column to the scapula. That is from here to here.
Sinovertebral nerve.
They are called as rhomboideus major. Rhomboideus. R-H-O-M-B-O.
The spinal dorsal lemma is the grand.
Rhomboideus major and minor.
Now, this
Rhomboideus major first is there and
is
minor
not
is
going
there.
to
Two
supply
muscles.
the
So
corresponding
major will be below and minor will be above. Two muscles are there.
to the
So like the different, so altogether
intervertebrate disc, above
five
as
muscles.
well as below.
You connect the vertebral column to
Patient
the
is having backache.
the-
Why there is
Then there are other muscles to find. If you remove these muscles, you get one more group of muscles. These connect the vertebral column
the distribution
to the
of
ribs.
nerve is like that. It gives a branch
From the upper part of vertebral column to the upper ribs.
intervertebrate disc.
That's one more from the lower part of vertebral column, that is lower thoracic vertebrae, to the ribs here, lower ribs.
Extending
From the upper thoracic vertebrae to the upper ribs. From the lower thoracic vertebrae to lower ribs, the two muscles are there.
what you are supposed to know.
One is called as serratus posterior superior. Serratus
right?
posterior superior. One more below called as serratus posterior
Then
inferior.
what you have to know is you know about
Serratus
disc
posterior superior
prolapse.
and serratus posterior
Now,
inferior.
intervertebral
Two
disc
muscles.
is
From
made
the
up of
vertebral column to the ribs here.
one is the
These are all superficial
outer
muscles.
part is annulus fibrosus. This is the annulus fibrosus. Made up of
Next you find
then
deep muscles are
in
there.
the inside will be
Deep
the
muscles.
gelatinous
Deep
substance which is called nucleus.
Deep muscles, usually there are two types of deep muscles. One is called as
This is
erector
the
spine.
alignment of counterpart,
erector spine.
right?
From the
Now what
pelvis
happens?
till the till the
The
skull.
peripheral part of the annulus
This muscle like this, one side is vertebral column muscle. This is called as erector spine.
This, the nucleus pulposus also.
There's one more muscle
Not that this is moving all the way.
from the frontal process. Goes to spine.
There, it becomes very
Spine.
thin.
Frontal process to spine.
So that
Okay. Next,
damage
deep
part
muscle.
of the annulus
Deep erector spine.
annulus
Next
fibrosus,
muscle.
nucleus
This is
pulposus.
called as transverso spinalis.
Compress the spinal nerve.
First one is erector spine. Erector spine.
That is what we call
From the lower part of the trunk here, going upwards.
thinning of
Skull. Okay. This is erector spine. If you remove that, you find one more muscle. One transfer process going to the spines of the spines of the vertebrae. Okay. This is called as transverso
Now the last
spinalis.
part
Transverso spinalis.
is the inguinal canal.
Transverso spinalis. Okay, now in these muscles now, again different subclasses are there.
Extent of inguinal canal.
As the erector spine, like this, it goes from here to skull, isn't it? This contains three parts. Three parts. Medial part, intermediate part, lateral part. Three muscles are there. Three muscle groups are there. Three muscle groups are there. The middle most close to the spine is there. This is called as spinalis. Spinalis. Erector spine has three parts. Medial to lateral. Medial to lateral. Okay. Middle most is called as spinalis.
4 centimeters in length.
Then middle part, intermediate part of the erector spine is called as longissimus. Longissimus. Right? Lateral most part is called as iliocostalis. Iliocostalis. So three parts are there for erector
Now
spine.
what is deep inguinal vein? It is the opening of the
Spinalis is close to the spine. This intermediate part is middlemost part of the erector spine. Next, the middle part is called as the longissimus part. Lateral most part is called as iliocostalis.
inguinal vein is the opening of the opening
Three
of
muscles are there. Okay, now spinalis. Spine. Now in each part, no, again there are three parts are there. Depending on regions. That means one part is present here. This part, one part present here. Here, different parts.
posterior wall through
Okay.
floor.
So Spinalis has three parts. Spinalis,
Anterior wall.
spinalis
By the
capitis.
external of the capillary.
Spinalis capitis. Spinalis cervicis.
Right?
Spinalis thoracis.
Formed by the skin.
Depending on the region. Capitis means going to skull. That part going to skull. Spinalis capitis. Spinalis cervicis. Spinalis thoracis.
In addition, the anterior wall, lateral part, is formed by
Middle part, intermediate part. Longismus. It also has same parts again. Longismus capitis. Longismus cervicis. Longismus thoracis. Okay. This also has same
Posterior
parts.
wall is formed.
Okay, now lateral part. Lateral part. This is a little different. It has no capitis.
And
It has longismus cervicis.
posterior wall is formed
Longismus
by one joint.
lateralmost part.
Is that the ilium?
One joint
Yeah, iliopostyle. Correct.
is combination of
Middle part is longismus, right? Lateralmost part. Iliocostalis. Iliocostalis has three parts. There's no capitis in this one. It has cervicis. Iliocostalis cervicis.
The roof is formed by
Iliocostalis thoracis. Iliocostalis lumborum extra. Iliocostalis lumborum. Iliocostalis lumborum. So no capitis. So you would say cervicis, thoracis, lumborum.
Now, what I want to know to carry to the clinical
Lumborum.
internal of the
Iliocostalis
taking
lumborum.
part in the
Iliocostalis thoracis,
partly
cervicis.
anterior wall.
So first two, finally and down ones, but they have capitis part. They don't have lumborum.
Internal of the
Other parts are same. Thoracis is there in both parts. Both.
inguinal canal. It forms
That is the parts of the rectus spinalis. It has three parts.
right.
Okay, if you remove this muscle, rectus spinalis, remove this. You get one more. The deep muscle, you get one more deep
Any
muscle.
abdominal
Second type of muscle.
come up to the
Okay.
deep inguinal
This is called as
inguinal canal and comes out.
transverso spinalis, right? Second
What we
muscle.
call the inguinal area. Now,
Transverso spinalis. That's a two muscle, right?
prevent
Rectus
the
spinalis.
internal of the
Transverso spinalis.
when the internal of the
Spinalis.
let us take this is the inguinal
This
canal.
transverso spinalis,
Now let us
here
take
it has three parts.
anterior wall, posterior wall, and the roof. Now anterior wall is partly formed by the internal object, the roof is formed by the internal object, posterior wall. When this muscle contracts, anterior and
It has three parts.
propagates and the roof comes down.
The first part, you get first
That
part.
means
When you know that it has second part. That means they are in a deep layers. Like it's not like a medial lateral.
is naturally
The second muscle, no?
by the
It has
contraction
three parts which are superficial deep.
by the contraction of internal object.
So most superficial part of the
Is called
transverso
Shatter mechanism.
spinalis
Clinical side
is
it asks what is
semispinal.
mechanism.
Semispinal.
You know the shutters of the shops that pull it down, right? So like this, the internal object
If you remove that, you get one
is
more
also
muscle.
going to
One more part of the transverso.
and
It's called multifidus. Multifidus.
right? Now, floor is formed by
Multifidus.
floor is formed by the inguinal
If you
ligament.
remove that, you get one more muscle. Third one. It's called as rotators. Rotators. Like three are there. So first muscle rectus spinalis has three parts. And all three parts they have three parts. Remove that, you get next muscle called as transverso spinalis.
Spermatic cord.
Transverso spinalis from transverso to spines actually. Okay, next if you ask you find three muscles, three parts are there, but they are in superficial deep order, not medial lateral. First one is called as semispinalis. Second one is called as multifidus.
Inguinal nerve is a branch of
Multifidus is the biggest part. Number three, multifidus. And third one is rotators. Semispinalis and semispinal has three parts. Same like the first one. Semispinalis capitis, semispinalis cervicis, semispinalis thoracis. Concerning only in the cervical and the thoracic. Semispinalis capitis, cervicis, thoracis. So that's the first one. Multifidus it has no complete parts. From the pelvis it goes up to the second cervical vertebra. It goes up multifidus. Okay, it's a very big one.
is common content for
That's about multifidus.
spermatic
Third one.
replaced in case of female
Third one is called rotators.
spermatic
This has three parts again. Cervicis, thoracis, lumbar.
throughout ligament of uterus and
Rotators, cervicis, rotators,
spermatic
rotators. So one has capitis, cervicis, thoracis.
what is deep
The third one has cervicis, thoracic, thoracic. So rotators has three parts. Rotators, rotators, thoracic. Rotators, lumbar. Is it confusing? Okay, one has capitis, thoracic, thoracic. Other one there is no capitis, you find lumbar. It seems like first I told you there is three muscles I told you at that time.
What are the mechanisms?
I said three minor is maximus and one muscle called as iliocostalis. Iliocostalis and lumbar, right? The same way. Only two muscles are there. Multipedal has no more parts there.
Number one,
Similar to that muscles only. Multipedal has no parts. So these are the muscles mainly, most of the muscles of that. So we cannot identify all that muscles, just identify only one outside muscles called as erector spine.
prevent the inguinal.
So if you're looking
Now,
at
let us say the inguinal canal is like this in my body.
Erector spine again because it's more most outside there. If we remove these muscles there, remove this muscle, next muscle will be in the erector spine. Superficial muscles outside the
Same place.
if we remove superficial muscle, deep muscles, most outer muscles is erector spine. That you can see.
When they contact,
The deep one you cannot see.
opening.
So on the back here,
What we call
I'll bring it. Can come to this side. So you have to see from this side, no? Okay. So back muscles. So this is one muscle there, first muscle I said. Superficial muscles. We find a muscle called a trapezius. Can you see this muscle here? This one? It's called trapezius. Trapezius. Actually, it's about like this, triangle-like muscle. If you add the two muscles of two sides there, form a trapezium-like structure here. It's from the skull to the 12th thoracic vertebra. It goes like this, big one. Trapezius. It goes from the vertebral column to the muscles of the upper limb, like clavicle and scapula. Okay? Trapezius. We are going to study this muscle when we are studying the upper limb. So it's a muscle of the upper limb. If you go back also, it's a muscle of upper limb also. Okay? Just one muscle. Next, this muscle here. This muscle here, this one, from here to here, this muscle. This is called as latissimus dorsi. Latissimus dorsi. This one. This one. Okay, next, this muscles now. These are the rhomboid muscles. It's mainly rhomboid is major. Rhomboid is major. Minor will be small part here. It's not separate there. Small part here. Rhomboid is minor. More up here. This rhomboid is minor. This entire thing is rhomboid is major. From here to here. Rhomboid is major. Rhomboid is minor. Then this one here. This one muscle here. Lifting here. This is called as levator scapula. This one. This is the levator scapula. Okay. This is levator scapula. Rhomboid is major, major muscle. Then minor will be small here, up here. Upper body is small, minor. So levator scapula, rhomboid is minor, rhomboid is major, latissimus dorsi, and trapezius. These are the muscles. From the vertebral column to the upper limb bones. Upper limb bones. Maybe from scapula to the clavicle or humerus. That way.
now let us take the trapezius is going like this.
If you remove this, you have to find the two more muscles called a serratus posterior, superior and inferior, but they are not so clear in this one, not clear. So next muscle you are seeing here is this one entire thing. You see here, this one. This entire thing is called erector spine. Erector spine. I said it contains three parts that also you cannot make out. Lateralmost part is called as iliocostalis. The medial part is called as longissimus, and the medialmost part called as spinalis. So three parts are there. Three parts. You cannot see them. And each part has three different parts again. So if we take the iliocostalis, it contains iliocostalis lumborum, iliocostalis thoracis, iliocostalis cervicis. Then this middle part is called as longissimus. It has parts like longissimus thoracis, longissimus cervicis, longissimus capitis. And spinalis again, thoracis, spinalis cervicis, capitis. So there are three parts are there. If you remove this one, you get like one more muscle. It's called as transverse spinalis, which again has three parts. And those parts are not like medial to lateral, they are deep to superficial to deep. Okay? That's about the muscles of the back. Most of the muscles of the back are supplied by the dorsal ramus. You know, spinal nose divided into two branches, ventral ramus and dorsal ramus. So dorsal ramus of the spinal nose supply the muscles back. Whereas these muscles supplying the muscles connecting the upper limb, those are supplied by some other nerves. For example, trapezius is supplied by the spinal axis, 12th cranial. And rhomboids, major and minor, they are supplied by the nerve to rhomboids. The nerve called as nerve to rhomboids. Levator scapulae, latissimus dorsi. Latissimus dorsi is supplied by the nerve called as thoracodorsal nerve. That's called as nerve to latissimus dorsi. So we are going to study that again in upper limb. Levator scapulae is supplied by same again nerve to rhomboids. So nerve to rhomboids supply three muscles. Levator scapulae, rhomboids major, rhomboids minor. Nerve to rhomboids.
You could take the nerve. And it's the nerves.
Yeah, first one is the trapezius. Trapezius supplied by the one cranial nerve. 12th cranial nerve, the spinal axis cranial nerve. Not 12, 11th, sorry. 11th cranial nerve. 12th is hypoglossal. 12th is hypoglossal, 11th. Spinal axis cranial nerve. Then latissimus dorsi is supplied by the thoracodorsal nerve. Thoracodorsal. It's a branch of the brachial plexus actually. Then rhomboids major, minor, levator scapulae, they are supplied by the nerve to rhomboids. Again, it's a branch of brachial plexus. Brachial plexus are formed by ventral ramus. These are called ventral ramus. Then we go on back. These are called ventral ramus. Yeah, nerve to rhomboids. Okay, that's the back there. You can see one small triangle there. This is the upper border of the latissimus dorsi muscle. Upper border of latissimus dorsi. This is the again lower border of trapezius. Then medial border of scapula, scapula bone here. Medial border of scapula. They all form a triangle there. This triangle. This triangle usually on the left side usually. Usually they used to auscultate the sound of fluid passing through esophagus in the olden days. It's called triangle of auscultation. It's called a triangle of auscultation. Triangle of auscultation. Between the medial border of scapula, then you find trapezius there, lower border of trapezius, upper border of the latissimus dorsi. Between them you find triangle of auscultation. It's there on both sides. On the left side it is used for that. So esophagus is located in that area. So it's for that on the left side. Right side is there, but usually use that. Next. So auscultate the fluid passing through the esophagus. The splash of the sound produced by the fluid.
Medial border, trapezius, and upper border of.
See, it has three boundaries. The triangle has three boundaries: lateral boundary, medial boundary, and inferior boundary. So three boundaries are there. Inferior boundary is formed by latissimus dorsi. Lateral boundary is formed by the medial border of scapula. Medial bone is formed by trapezius. Okay. Medial bone is formed by trapezius. Lateral bone is formed by scapula. Ischium bone is formed by the latissimus dorsum. The floor of the triangle contains a muscle called a rhomboides major. The floor, you can see in the floor, in the depth, you can see a muscle called a rhomboides floor.
Now, what is its clinical importance? Now, in olden years, what they used to do, in order to remove cerebral pain, they used to observe some next approach is called
That's all about the muscles here. Now, little bit about the inguinal canal. So I'm not going to explain much that inguinal canal because this you have done already long back. Inguinal canal is a opening, it's a canal, it's a muscular passage you can see. It's present in the lower part of the anterior abdomen. There are muscles you can see in the anterior abdomen. There are three muscles are there mainly. One is called as external oblique. When you go inside you find internal oblique. Then you go inside you find transversus abdominis. Three muscles are there. Okay? Three muscles you find. Then if you go after the third muscle, you get one more muscle. One more fascia is there, not muscle. It's called fascia transalis. Fascia transalis. So, inguinal canal is a path used by the testes to come out actually. Testes to come out. So this is testes, you can see it has come out there. Actually comes out from the abdomen by passing to the canal. So this inguinal canal extends from two openings. So this is the one opening here. This is called as superficial inguinal ring. This opening of superficial inguinal ring. This opening you can see present in the outermost muscle, external oblique muscle. Then this canal, other end of the canal, present a deep inguinal ring. Deep inguinal ring. So the canal means it has two openings, right? Canal means the tube means it has two openings, right? One opening is called a superficial inguinal ring, more superficial. The other end is present at the deep inguinal ring. Where is a deep inguinal ring? Deep inguinal ring is present in the fascia transalis. So this canal extends from the okay, this is the external oblique muscle, first one. Then you find fascia transalis, as a fascia transalis. Okay? In the fascia transalis you find an opening there. Opening. Deep inguinal ring. In the external oblique you find one more opening. Superficial inguinal ring. So between them you find this canal is running. Canal. What about other two muscles? The two other muscles come between, right? Those two muscles, internal oblique and transverse muscles, they arch like this. They arch over the canal. That means if the canal is present below those two muscles, they arch like this. Okay? This superficial inguinal ring is most outside.